The Commonwealth has made great strides in lowering the cost for people 64 and younger, and Mass Senior Action wants to continue that progress to people 65 and over. The issue, like most of our priorities, bubbled to the surface when members began to share their struggles of trying to pay for basic health care costs. Massachusetts seniors told us of trying to choose between calling an ambulance or waiting to see if the chest pain subsided because fearing the cost. Seniors told us of trying to balance their monthly Medicare premium and buying groceries. And after hearing story after story, the members of Mass Senior Action said, "We are not going to take it. We are going to take charge."
We've come today, Governor. Good morning, welcome. We're from across the state of Massachusetts.
Yes.
We are elder seniors from the Senior Action Council, and we have filled this box with cards from citizens all across the state who are discussing the mass health initiative that we are trying to see passed. It is going to the legislature today.
There's been
filing today.
Yes, it was filed in the Senate House, and what it does is close the gap of costs for health care for seniors, because with all the great leadership that our state has had in healthcare reform, we forgot about some of us. When we get 65 now, we actually lose a lot of coverage. You're probably familiar with it from your own experience in the healthcare system. And what this bill will do is take advantage of federal programs to bring more federal dollars into Massachusetts to help close that gap. And we would really like to work with
Is there a copy of the bill in here?
We can certainly get you a copy of the bill right away. It's very short and very technical, but there it is.
Thank you.
This is our Executive Director, Caroline.
Well, thank you all. I have you. Nice to see you. Okay.
Can we get a picture of you holding a card?
Sure.
Oh, that's great.
I think there's over 4,000 in there from across the state.
All right, now I want everybody to find their card. Put it back in the box.
I bet you can find my James, where are you?
Well, we're here also because, as Mass Senior Action Council, realizing that it's also the last day. Actually, we've had a couple of, I think it was Representative Garlick and Senator Wolf, who have already submitted the bill that we are looking for your support on. And so I believe the paper has information on that. And we're basically asking in the House, the bill is HD 667, HD 670, and in the Senate it's SD 41, SD 42. And basically what it's all about, the problem is, as you're probably well aware of the high out-of-pocket costs for seniors over 65, and that as Mass Senior Action, we have been collecting signature cards because we believe we have some solution to the problem, as other states have already come up with some solutions, and that is to eliminate the acid test that people have to go through, or raise the income level eligibility for Medicare and savings program. We also think the application for it should be simplified. I think right now it's 28 pages long, which, for some seniors, it makes it impossible to maneuver. So we have some simple suggestions that we think would certainly help address this issue. Because many of our own members of Mass Senior Action, we find that they are in a situation where either they have to make a decision on a monthly basis Am I going to buy food, or am I going to spend the money on medication, for instance, or doctors and that kind of thing? We're saying that's not fair. You're talking about seniors who've worked their whole lifetime, who would pay their taxes, and now when they are in need, we as a state are failing to address this gap that they're facing. And so that's why we're asking for support on this, and we hope that you'll be able to do that for us.
In 3 days, we will honor the memory of a great leader, Martin Luther King Jr. In 1956, I was in Montgomery, Alabama, for basic training as an Air Force nurse. I saw the people walking and carpooling to work as a result of Rosa Parks' courageous stand not to move to the back of the bus. I would go into town on Thursday evenings to hear Martin Luther King Jr. speak to the people, exhorting them to keep going and not to give up, like we are going to do.